Lyme disease, getting to the true root cause. Hi everyone, I'm Dr. Michael Johnson. I'm a board-certified chiropractic neurologist. I've been in private practice in Appleton, Wisconsin since 1983. 39 years of practice to back me up. And we're here today, it's early on a Saturday morning. We're here today to talk about Lyme disease and its co-infections. So let me tell you up front what the true root cause of Lyme disease is. It's iron dysregulation. And in many cases, it's iron overload. Too much iron stored in your system. And bugs, bacteria, viruses, parasites love an iron-rich environment. So you're never going to be truly healthy until you address this issue. I can promise you that. And you can check to see if you have iron overload syndrome with a simple blood test. It's $29. It's a ferritin test. It measures the amount of iron stored in your body. Iron should be circulated and not stored. So there are some out there that say, no. You just can't do a ferritin test. $29. You have to do a magnesium, zinc, and copper panel. You have to do a complete iron panel. Folks, that costs like $250. Most people don't have $250 to see if they have a problem. But they'll spend $29, even $39 or $49 to see if they have this iron overload system. And you can have these lab tests done on your own. You don't even need to go to your doctor. You can go to, let me tell you, Request a Lab, Any Lab Test Now. Any Lab Test Now is down in Milwaukee. Walk-in Lab, Quest Direct, LabCorp On Demand, and Direct Labs. All you do is just Google, order my own lab test near me. But that's what it takes. Because look at the symptoms if you've got too much iron in your system. Right here. Hopefully you can read that. Look at the first one, inflammation. Well, massive inflammation is the cause of a lot of chronic conditions. Numbness, tiredness, fatigue, weakness. Does it sound like Lyme? Weight gain, weight loss, abdominal pain, high blood sugar levels, hyperpigmentation of the skin, or bronzing, loss of sex drive, reduced testicle size in males, reduced or absent menstruation in females. And look, in time, the following conditions may develop: chronic pain, arthritis, liver disease or permanent scarring, cirrhosis of the liver, enlargement of the liver, diabetes, severe thyroid disorders, heart disease, pancreatitis, high cholesterol, cancer, stroke, kidney disease, lung disease. Do you see why you have to get this addressed? Do you see why I call it the true root cause? Let's talk about cholesterol, because everybody and their uncle is on cholesterol meds. It's crazy. Your normal cholesterol, when I was first in practice in 1983, 300 or lower. Then they developed statins, medications. Well, then they kept dropping. Now they want it like 120, which is absurd. You need cholesterol for your brain, folks. You need it to insulate your nerves. You need it to make hormones. Cholesterol. When iron is high, magnesium is low. When magnesium levels are low, the enzyme that creates cholesterol, the HMG coenzyme A, goes into overdrive and creates excess cholesterol. Hello? Let's address the iron overload syndrome. And you don't need billions of dollars worth of statins every year. Stress. Stress can cause high iron and low magnesium, which can lead to higher cholesterol. And not just emotional stress, but environmental chemicals, heavy metals, poor diet, lack of sleep, mold, toxins, EMFs, food allergies. It's not good. Aging. Let's talk about aging. Aging is iron oxidation. It's rust. due to too much iron in your system. And inside the mitochondria are powerhouses of the cell, which stops the production of ATP. ATP is the energy-carrying molecule inside the cell. That is the cellular event that causes aging. So, okay, Dr. J, I went and had a ferritin test. My ferritin level is high. Well, didn't you say iron dysregulation? Yes, iron dysregulation means it can be too high or too low. So normal ferritin level is 20 to 50. If it's above 50, it's too high. My ferritin level, and I'll show you this, my ferritin level, the first time I checked it, was 365. That's way too high. 300 and above is something called hemochromatosis. It's a serious condition. Now, the second time I checked it, I've got it down to 298. But yeah, not good. Not good at all. And you can run a ferritin test for $29. And like I said, even if it was $49, it's worth it. You saw all the symptoms that it can cause. Look into it. So here's the blood work needed. So you get the ferritin test back. It's either too high or it's below 20. So it's too low. That's iron dysregulation. Iron overload is just where it's too high. So let's qualify that. So here's what you want to look at. Serum iron, iron saturation, total iron binding capacity, serum ferritin, transferrin, copper, ceruloplasm. Ceruloplasm, you've heard, is glucose is the master antioxidant. It's really ceruloplasm. And it helps with the bioavailability of copper. Magnesium in the red blood cell, plasma zinc, hemoglobin. This is an important one, vitamin A. Your vitamin A level should be 3 times higher than your vitamin D level. That's very important. Red blood cells and hematocrit. Well, let me show you mine the first time I ran it. Keep in mind, here's my brief history. My brief health history is I have peripheral neuropathy. I was diagnosed with MS in 2009. I went and had stem cell. Stem cell helped me personally with my MS. Way back in 2008, I was diagnosed with Hashimoto's, so I do have an autoimmune thyroid. Then I go in and I have emergency gallbladder surgery a couple of months ago. And they give me too much Lasix because I also have pneumonia. Lasix is a diuretic, causes congestive heart failure and acute kidney failure. Now I'm on the mend, my numbers are improving, but yeah, serious health conditions. I also have a kidney stone. I've got AFib because I have Graves. So my Hashimoto's flipped over to Graves. So that's my brief health history. Now I'm going to show you my blood work and you'll see, oh, this guy's a mess, but I'm working on improving it. And a trauma like a surgery, emergency surgery, can flip things. And that's what it did for me. I flipped from Hashimoto's over to Graves. That drove the AFib, irregular heartbeat. The diuretic caused the kidney and congestive heart failure. So too much of a medication isn't necessarily a good thing, but I had severe pneumonia. They had to clear my lungs in order to do the surgery. I get it. So here we are. My serum iron was 69, that was low, should be 100. My iron saturation was 27%. Total iron binding capacity was 255. My serum ferritin, here's the one, this is why I told you to get that test, $29, 365. Now on my second test, I've got it down to 298. We're headed in the right direction. Serum transferrin was low at 217, so that high iron is going to skew everything. You see it here. Copper is 120 is high. Ceruloplasm 28.9 is low. Magnesium a little high. Zinc a little low. Hemoglobin was low. Here's the kicker right here. My vitamin A was the exact opposite of what it should be. It should be 3 to 1 A to D, and I was 1 to 3. It was totally flipped. And so when you have too little vitamin A, you're going to end up with multiple autoimmune conditions. My RBCs were 4.2, that was normal, and my hematocrit was 35.2. So that is the iron overload testing, complete testing. But you just don't want that. You really need a complete metabolic panel. You need a complete lipid panel. You need a complete thyroid panel because thyroid drives your metabolism. And you need a CBC, complete blood chemistry with auto-diff, breaking down the red and white blood cells, especially with Lyme disease. Here's why. This is why. This is why you need complete blood testing. A complete metabolic panel will test your glucose levels, gut function, adrenal function, kidney, liver. Why is that important? Well, glucose, your brain and nerves need two things to survive, fuel and activation. Fuel is oxygen and glucose. And it's quite obviously why you want to look at your gut function. Make sure you don't have leaky gut. Make sure the fact that you have enough hydrochloric acid. Adrenals are your stress glands, kidney function, liver function. You need to look at all of it. You need a complete lipid panel. This test will check your cholesterol, triglycerides, cholesterol and HDL ratios. So it shows your risk of suffering a heart attack. HDLs and LDLs. CBC with auto differential is number 3. I told you about that. You want a complete thyroid panel. The thyroid drives your metabolism. And then you want to look at inflammation. Lyme disease patients always have a lot of inflammation. So you're looking at homocysteine and C-reactive protein. Well, when you get your blood test back, and again, this is my blood work, so you got nothing to worry about with HIPAA. When you get your blood work back, it's going to look like this. It's going to come in a packet, which means nothing to you. So what we do for our patients is we give them a readout off of our database. So there are lab ranges, and the high lab ranges are in red. There are functional ranges. Functional ranges are a little more practical, and they're in yellow. So let me give you an example. A functional range of your liver, AST or ALT, liver enzymes, are 0 to 40. That is the lab range, I should say. So the lab range is 0 to 40. The functional range is 10 to 26. So why should you wait till you get out here to 45 when you're already here at 26? We don't want this going up anymore. So that's why you look at functional ranges compared to lab ranges. So I always think and feel that you should give credit where credit is due. This is a book by Rick Malter, The Strands of Health. He talks about HTMA, hair tissue mineral analysis. Now, we also do HTMA in our office in conjunction with the blood work. Why? Well, your magnesium level. Your magnesium level could be normal on the blood work, but it's not normal up in the hair. So you want to look at that. It's very important. Another great book, I highly recommend it, by Morley Robbins. It's called Cure Your Fatigue. Now, I really love that book. It's excellent. I don't agree with everything he says. Morley Robbins does a great job talking about mitochondria, but he doesn't mention anything in support of mitochondria, like supplements. I think you should support the mitochondria. Very important. The powerhouses of the cell. He has a more cookie cutter approach. I don't think you can't use a cookie cutter approach on everyone. Yeah, it's going to help some, but the tough cases, tough Lyme disease cases, it's not going to work. He doesn't like the use of zinc or calcium at all, and in some cases it might be necessary. This is the individual approach. You know, I've been in practice since 1983. I've learned a thing or two. So that's my take on it. So great book. I just don't agree with everything. I mean, Ray Peat talks about iron overload, but I don't necessarily agree with how he addresses it. And then I have a very good friend, Dr. Robert Selig. He's down in Chicago. I call him the master of minerals. So you take all this information and you combine it to what works best for the patient. That's important. Well, you can say, And this is a question I get. How do I know if this will work for me? Dr. Johnson, listen, I've had Lyme disease for a long time. I have some co-infections. I'm just tired of trying things. How do I know this is really going to work? Well, like I told you, it's a simple $29 ferritin test. Go have it done. Any lab test now, or any of the ones that I named in the very beginning. Even if it was $49. You saw all of the symptoms, especially inflammation. And Lyme disease patients always have inflammation. And you can say, will this work for other conditions? You know, I just don't have Lyme, I have an XXX, whatever. I have other conditions. Yes. To me, this is the root cause of any chronic condition out there. It truly is. It's the true root cause. And then I get this one a lot. Well, it shows you I got financing there. How long and how much? And like I said, we offer financing. And that's why I started here, so I don't forget to tell you. Because it's expensive. I'm not going to kid you. All that blood work is expensive. If you went and had this blood work done at a hospital, it'd be $5,000. So we do offer patient financing, make it affordable for you. We offer 12, 18, and 24-month programs. The 12-month program is $11,995. The 18-month is $14,995, and the 24-month program is $19,995. It takes time to get this corrected. It's like turning a ship around. Those are our fees. We offer financing. And I can give you a list of everything that's included. Obviously, the blood work. And then you're going to have to follow up with that. So, if you'd like to see if you qualify to be a patient, you can email me at drmlj83@gmail.com. drmlj83@gmail.com. Why do I say qualify as a patient? Because I've had patients in the past who won't change their lifestyle. They'll keep eating junk food. They'll keep downing that 12-pack of Mountain Dew a day. I've worked with COPD patients, and we've helped COPD patients with their breathing, all because of what I've laid out for you here. And we've helped them, but they won't quit smoking, even though they told me they would. That's what I mean by qualify as a patient. Share this video with your friends, family, and on social media, YouTube, share it on Facebook, Instagram. Like and subscribe it. And again, if you want to get in touch with me, you're interested in working with us, drmlj83@gmail.com. So that's what it takes. Hopefully you've got some information. At the very least, get the ferritin test done. Get it done. And like I said in the beginning, the true cause of any chronic condition, including Lyme disease, is iron dysregulation. It's either too much iron, above 50 with the ferritin test, or too little iron, below 20. So take a look at that. Just do it. It's for your own good. And then what you do with the information that you have, that's up to you. I'm Dr. Michael Johnson. Listen, thank you for taking the time. Don't forget to share this video. Email me if you're interested, drmlj83@gmail.com. I'm Dr. Michael Johnson. Thank you for taking the time to watch this video, and I look forward to helping you in the future.